So the debate about whether it is better to get a Medicare Supplement Plan versus a Medicare Advantage Plan has been going on since, well, since there's ever been Medicare Supplement and Medicare Advantage Plans. But since we did Medicare Supplement Plans in the last video, part 1 of our Is Medicare Supplement or Medicare Advantage Better? Check that out. I'll put a link up there for as well. This time around, we're going to talk about Medicare Advantage Plan. Now, this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods, extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, please don't forget to like and subscribe, because it does help the channel to grow, and we are thankful for that. But also because it'll keep you up to date about the newest Medicare changes, the newest Medicare options, and ways to make more, better informed Medicare decisions. All right, here we go. So in the first part of these 3-part series, we discuss what are Medicare Supplement Plans and how they work in short. And this time, let's talk a little bit about Medicare Advantage Plans, because Medicare Advantage Plans have some pros, but they also have some pretty serious cons, really like anything. But they may feel more familiar in how they function than a Medicare Supplement Plan, because they work much more like a standard health insurance plan that maybe somebody had through their work, or through a health exchange, or through a Medicaid or Medi-Cal, or through a spouse, or maybe even through a union prior to turning 65 years old or becoming eligible for Medicare. Now, just a real quick recap. Let's talk about how Medicare works in general, so we can focus on how the Medicare Advantage Plans work in the specific. Now, Medicare is a healthcare program that is run by the federal government, and it's made up of 2 parts called Original Medicare. There is Medicare Part A and Part B. Those are the 2 parts. And Part A covers the costs that come from being hospitalized, or being in the hospital, specifically from being admitted to the hospital. It generally doesn't have a monthly premium for the vast majority of Americans who are enrolled in it, but it does have a cost when the services are used. And those costs can range from one-time deductibles up to daily rates to basically 100% of the cost of staying in a hospital. The second half of Original Medicare, Medicare Part B, is for more like day-to-day care things, like doctor's visits and lab works and x-rays and things like that that you'd use on the daily basis. Medicare Part B does have a monthly premium that is $174.70 a month in 2024. And this is paid as a premium, meaning that it gets paid whether somebody uses services or not. It has to get paid monthly, usually taken out from someone's Social Security benefits. Then in addition to that, there is a deductible and a share of healthcare costs that roughly breaks down to 80% paid by Medicare Part B and 20% paid by the beneficiary, but there is no real limit to it. So that 20% is going to be 20% of whatever the total cost can be, and that can be a lot. Although both Medicare Part A and Part B, or Original Medicare, cover a pretty wide swath of healthcare needs for seniors, they don't cover everything. And aside from the shares of costs like the 20% or the deductibles, they do not cover things like the full dental coverage or hearing coverage or transportation, or the biggest one is prescription drug medication. That's where a Medicare Advantage Plan starts to make sense. Medicare Advantage Plans, sometimes called MAPDs or Part C plans or Medicare Health Plans, they are private health insurance plans that are eligible to anyone who has both Medicare Part A and Medicare Part B. Super important to mention is that to be able to get a Medicare Part C plan, the beneficiary must have and maintain both Medicare Part A and Part B. So if they only have Part A or they only have Part B, then they will not be eligible to keep or maintain or to enroll into a Medicare Advantage or an MAPD plan. Additionally, in the last video, we talked about Medicare Supplement Plans, which are essentially additional coverage on top of normal Original Medicare, and they pay for some or almost all the costs not covered by Medicare. But Medicare Advantage Plans are more of a replacement of Original Medicare. Sure, somebody must be enrolled in Medicare to get a Medicare Advantage Plan, but when they go see a doctor, when they go to the hospital, when they pick up their medications, they will use their Medicare Advantage health insurance card and not their Medicare card when they go to utilize those services. So instead of an additional coverage, it's more of a instead of Medicare coverage. The companies that have Medicare Advantage plans are the same ones that you would typically offer normal health insurance plans, like before 65-year-old health insurance plans. So really big names, but also there are going to be some small indie companies that they just specialize in Medicare plans, and that's really up to the individual which one they like better. Some Medicare Advantage plans, they have monthly premiums or monthly costs, but many of them, especially here in Southern California, they do not. So they'll have like a $0 monthly premium, but someone does still have to pay the Medicare Part B premium or stay enrolled in Medicare Part B, which of course for 2024, $174.70 a month. When care is used, there's usually a deductible, a set copay for things like doctor's visits or specialist visits, or even maybe a co-insurance where they share a percentage of the cost, or even a limit to how much someone can pay for their medical services within a year. The two biggest differences on Medicare Advantage plans in comparison to a Medicare Supplement plan is one, how someone's care is managed, and two, prescription drug coverage. So let's talk about the system of care first, because Medicare Advantages are more like typical health plans, and they mostly are HMO plans or Health Maintenance Organization plans, which means that they will have a network of doctors and hospitals and clinics that someone goes to, but if someone wants to go outside of that doctor's network or that clinic or those specific doctors' networks or hospital networks to go see a specialist, for example, they would not usually be able to do it without prior approval from the insurance company. Admittedly, HMO plans, they have gotten a lot better in the last decades since the rise to their prominence. But some folks just feel like HMOs are not the right style for them for their health care, or feel very constrained justifiably by the HMO. And again, not all Medicare Advantage plans are going to be HMOs. Some of them, especially recently, are really springing up to be the preferred provider organization, or a PPO, or a point of service plan. That means that folks will have a wider access to doctors and hospital networks, but at a potentially higher cost for usage if someone does end up going out of network or going to a non-preferred provider. And these types of PPO plans for Medicare Advantages are still going to be the minority at the moment. The second big difference with a Medicare Advantage plan, especially with an MAPD, is the inclusion of prescription drug coverage. Because unlike Medicare Supplement plans, having a Medicare Advantage plan including a drug coverage, which is just a Part D plan, the one you usually have to buy separately when you get Medicare Supplement, they just kind of tack it on together. And the Medicare Advantage plan will already have it included in the benefits and the cost, and oftentimes there's not an additional cost to have that prescription drug coverage. So that is a nice benefit. The last thing we're going to talk about when it comes to Medicare Advantage plans is when someone can enroll in one, because it's a pretty big difference from the Medicare Supplement side. First things first, a Medicare Advantage plan cannot look at someone's health conditions or their health history or their medical history and make any changes to that plan as far as premiums or costs, or even deny them because of that medical history. It's something called a guarantee issue. That means that regardless of one's health history or even their health situation, they cannot be denied, and their monthly premiums, if there are any, those can't be raised as well. But there are still going to be limits to when someone can apply. For Medicare Advantage plans, folks can enroll when they first become eligible for Medicare, usually at 65 years old. And they're going to have a 7-month period in the very beginning to do it. So 3 months before the birthday, the month of the birthday, and 3 months after, which is called the Initial Coverage Election Period, or ICEP. Now, aside from that time frame, someone who has both Medicare Part A and Medicare Part B would need to wait usually yearly to the annual election period, which starts every year from October 15th through December 7th. And during that time, they can change their MAPDs or opt in and opt out of a Medicare Advantage plan, or even go back to original Medicare if they prefer. Outside of that time frame, though, unless someone has a very specific reason, they are likely not going to be able to change their Medicare plan. And most beneficiaries won't be able to make those changes until the annual election period comes back around at the end of the year. But there are exceptions to that for a special enrollment, or if folks have something like Medicare and Medi-Cal, or maybe if they have specific illnesses. So just as a recap, the main points for Medicare Advantage Plan is first that it is a private health insurance plan for Medicare beneficiaries, and it takes the place of having original Medicare. Yes, you're still enrolled in original Medicare, but Medicare becomes a secondary payer, and the Medicare Health Plan or the Medicare Advantage Plan is the primary payer for all your healthcare services. Now, although you still have to have Medicare Part A and Part B to get Medicare Advantage Plan, original Medicare moves to the back. Additionally, it has specific times throughout the year when someone can enroll, and the coverage is going to be similar to an under 65-year-old plan with things like copays and deductibles and co-insurances, and many of them, almost all of them, not all, but almost all of them, include prescription drug coverage as well. But on the other side of that, the coverage is usually going to be managed through an HMO plan unless you choose a PPO, which again are the minority. And there could be limitations on those HMOs for doctors, hospitals, and clinics that a person utilizes for their health care. And you know, that can oftentimes be very frustrating for some folks. All right, so that's gonna be it for today's Michael's Medicare. And of course, if you have additional questions or you wanna get more information about your specific situation, feel free to reach out to us at the information down below, or leave a comment, or give us a call, or check out our other great videos on the socials on YouTube and Instagram. We have amazing Medicare content coming out every single week. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.